Maptenjag Sapa, good day.
Hello, good day.
Good day. I am pleased to meet you.
Kawisag Sapa, good morning to you.
Good morning.
Hello, good morning.
Good morning to you as well.
How young are you?
I'm 19 years old po.
I am 19 years old.
I'm in my early 20s.
I'm already in my late 20s.
I am 27 years old.
What are you up to right now in your daily existence?
I am working as a district health manager of the Interlocal Health Zone.
I am currently in my second year of nursing school.
I am presently focusing on completing my bachelor's degree in nursing.
I'm about to earn a college degree and obtain my nursing diploma.
Do you think there are any problems in the healthcare systems in the Philippines?
I assert that the Philippines management function is still continuing to fight for fair and equal access to health services. Um, there is still a challenge in regard to acquiring health insurance and the development of the healthcare delivery.
In my perception, our healthcare quality here in the Philippines is still far from the course of quality enhancement.
Yes, in some instances, but I am assertive that the Philippine government is doing its best to fulfill the healthcare needs of Filipinos. Of course.
I believe that the government continues to underfund our healthcare system, particularly to the concerns on improving the healthcare providers' abilities and establishing a better method for services and as well as listing essential medicines.
Are you satisfied with the healthcare systems we have in the Philippines?
As a nursing student, the way I see it, I think that the Philippines healthcare system is conducting enough support for the Filipinos. So, yeah, I am satisfied with it.
Yes.
Mm, yes.
Well, to be honest, not really.
If you ask me if I am pleased with our country's health service, I will honestly say no.
To be honest, I am discontent with our health sector as it only covers a limited area in our country.
To formally introduce myself, I am Christina Garcia, 29 years old, and was born in Benguet. Nice to meet you.
Hi, I'm Joseph Darwin and I've been living here in Benguet for the past 10 years as a volunteer nurse.
It is true that our community is beautiful. It can offer a lot of locations, food, cultures, and let tourists enjoy and learn about our community, which is one of the reasons why our economy is high, especially in summer season. But despite all those things, we are still struggling, especially living in the centralized area. Even though health units cater to our needs on a daily basis, it is hard not to notice that there are still areas that are lacking.
In the Barangay Health Center in my hometown, medical supplies are readily accessible since LGUs and even private sector always donates and help. Equipments and can be seen to be more technological, especially in doing paperwork, since all of the data are stored in a computer and was organized monthly. Lastly, all facilities can be seen as new and clean for the preservation of good health of the people. On the other hand, here in Atok, there are drastic differences in medical supplies, equipments, facilities, and even training for volunteers.
There was one time when my father was in need of urgent care because of food poisoning, but the nearest RHU in our town does not have enough supplies to help. In addition, the medical volunteers weren't skilled enough to know what to do with him. With that, we had no choice but to drive almost 4 hours to reach for the second nearest RHU. Fortunately, we arrived on time, and my father was immediately given medical attention and began to feel better. At the time, I was frustrated because of the condition of my father, and the volunteers in the RHU in the community do not have a clue on what to do. With that experience, I realized that Atok Benguet is a nice place to visit, but to live here can be dangerous, especially to people who need help and care for the healthcare system.
Benguet has a lot of potential that can offer to its people, but without enough funding to support its need, it can be a depressing situation to live in.
I really don't know why there are still problems since there are already a lot of existing laws, regulations, and reforms that are being implemented by our government, which aims to help the community, especially those who are in the decentralized and marginalized areas. We have an interlocal health zone which caters the health needs of people in Benguet that is also aided by JICA, as well as the Universal Health Law.
Hay nako, puro na lang law, law. Tambak na nga mga laws natin eh. Ang problema, hindi naman naaayos. Hindi na ipapatupad.
We understand your point, ma'am, and I am completely with you. I agree that our healthcare system still needs a lot of improvements. That is why our government must give their best to achieve the principles of these laws and ensure that everyone will benefit from these, most especially the poor and the people living in geographically isolated areas. It might not be a lot, but it can give opportunities to everyone to have access to healthcare.
That is exactly why the reason the UHC law was created. It aims to address the issues of the healthcare system. It outlines that the required health system improves to increase the financial protection and provide all Filipinos with access to healthcare. All of the citizens are entitled to the benefits and to get subsidies. You just need to be a member of PhilHealth. This is obtained by means of numerous subsidized and contributing schemes to address the shortage of our healthcare professionals. The Department of Health will increase its deployment programs to support workforce requirements. For every government-sponsored student, there will be a required to serve for at least 3 years in the region designated by the Department of Health.
You all have those policies and laws, but why can't we rely on those when we need it the most? It doesn't make sense.
When can we get a glimpse of the sun rays in the darkness filled within our healthcare system? Are we going to be left behind in the shadows?
Barriers to healthcare access can be detrimental to community health since prevention or treatment is not preceded or sought immediately. So, hearing the complaint of the people in the centralized areas, such as Benguet, I eventually realized that there is a serious problem with the accessibility of rural health units in rural communities. Thereby, I genuinely think that an expansion of facilities and services should be readily accessible to ensure the protection of rural communities, particularly in terms of physical and mental health services. Without a doubt, I think that it will be immensely helpful to rural residents.
Okay, so if I would be in the position to impose change in the management of healthcare system in our country, I will focus more on the proper allocation of funds to meet the goal of promoting equitable access to primary or basic care and other health emergency services, especially to the rural health units. I genuinely believe that this small step will consequently lead to a significant breakthrough in medical service. We must continue to explore new studies,
develop and implement an improved quality of healthcare services,
and ensure to provide a beam of light in the areas in the shadows, which is the rural community.